My name is Kelly Simmons. I'm a student at George Mason University in the HAP 360 class. This presentation gives a details of an example design of EHR plan to improve care process. The objective of process improvement through EHR are to analyze the information that a clinician needs to manage a depressed patient based on their genetic information, and also use genetic information to manage depressed patients. Assumption. In this scenario, the patient's name is patient A. Patient A is scheduled for the first visit to a private practice to see a primary care physician. The practice has HMO staff model. Patient A has an insurance. Patient A and providers have access to email and internet. Patient A is seen by a primary care physician at a clinic. Patient A is referred to a private practice of psychiatrist. Patient A is suffering from an unknown form of depression. Patient A made a first call to the primary care practice. They will be needing patient A's full name, age, date of birth, insured or insurance type, and the reason for the visit. First visit to the primary care physician will be patient A's demographics, in patient A's insurance information, patient A's history like family history, medical history, social history, and also patient A signs and symptoms when it appeared, patient A's if patient A is allergic to any medication, and a brief note about the description about patient A's depression. The first visit to the primary care physician will be the physician has to evaluate the patient's condition. The physician has to prescribe the patient who will be needing an antidepressant medication. The physician suggests a follow-up within a week. The pharmacy receives prescription and patient is given the medication in a day. Follow-up with the primary care practice. That will be week 1. Patient's condition remains the same. The physician performs an assessment and recommends patient A to a psychiatrist. Refer is made and patient A makes an appointment for the next day. The first visit to the psychiatrist will be the reason for the visit, patient's demographics, patient symptom, inf- insurance information, and patient's history will be social history, family history, and medical history. The first visit with a psychiatrist is week 2. Patient is seen by a psychiatrist. The psychiatrist recommends patient for genetic tests to understand the depression and to find the right medication. The psychiatrist orders a DNA kit for genetic testing for the patient, which will arrive in a week. In the meantime, the psychiatrist recommends the patients to continue the same prescription while waiting for the genetic testing is done. The patient reschedules the another appointment with the psychiatrist. The second visit to the psychiatrist will be week 3. The patient comes in for second visit. DNA kit arrives at the practice. The test was performed by swapping on the inside of the patient's cheek. The kit is sent back to the lab. The patient continues the same treatment. The third visit to the psychiatrist will be week 4. Patient returns to the psychiatrist's office. Patient and the psychiatrist are waiting for the the result from the lab. The psychiatrist evaluates patient's condition and sets him for another follow-up within 4 weeks. Initial treatment is continued. 4 to 8 weeks from first visit from the psychiatrist. The psychiatrist received the genetic information from the lab. EHR is updated with the genetic information. The information reveals the kind of severity and features of the depression. The patient is prescribed a different antidepressant and the prescription is sent to the pharmacy. The patient is asked to continue to follow up with the psychiatrist. Patient A's condition improves. The new medication and the talk therapy seems to work for patient A. The treatment was based on the patient A genetic information. Implementing use case. This shows the roles and actions of multiple actors contributing to the care and treatment for patient A. Information exchange among multiple actors. This table, there are multiple actors who exchange information about patient A genetic information. Summary. This design suggests that the requirement should include how the genetic information matches in treatment for the patient. Demonstrate how many staff members get involved in the procedures to help improve the patient's health condition. The staff members exchange information and results about the patient. Using the EHR help identify and coordinate the care or plan for the patient. Thank you for listening to my presentation.